how does this addiction take place? What is actually happening from the beginning and the end? ठीक है ना? So like we had a teacher, we are saying that ki be smart, do not start. है सभी को बोल रहे हैं ना, be smart, do not start, do not start. So how does it? What does it mean? क्या होता है? अगर हम एक बार स्टार्ट कर लें, अगर मैं if we
don't even start.
Pardon me, Dr. Rajkumari?
Sir, I mean to say that once we started, it is like an addiction going on a vicious cycle, and it is very difficult to break this vicious cycle because you get trapped in it. There is a activation and deactivation.
So, पहला, why will a child start?
Because of the environmental influences, because of the curiosity.
Okay, Dr. Visuja, क्या बोल रहे हैं? Because of the curiosity.
Because of the curiosity, if the child is starting off it, if he is a teenager, and because of the social
peer pressure, social this thing, the Shah Rukh Khan comes and says that कि मेरे को तो वाह, मेरे को कितना मजा आ रहा है, ठीक है ना? So all those things, that things comes up, and then this person actually, out of curiosity, what will he do? He will experiment. Right? And then what happens? He will experiment. Anyone of you have ever tried experiment? एक बार, हैं? Why you all did not try? You had no curiosity.
Because of awareness.
Because of
Awareness.
Don't tell me that. You have not been in the college and nobody has even pushed you into it. That has happened to all of us, I think. Really?
No, sir. No, sir.
कोई नहीं बोला, अरे बर्थडे पार्टीज में तो क्लास 12 के बाद में बर्थडे पार्टी जब होता है तब तो हुक्का तो वहां रखना जरूरी है. तुम लोग तो उसी ग्रुप में हो ना, जब हुक्का तो बहुत एक्सपोजर मिला होगा. एक बार सिर्फ एक.
No, I said everybody has a story. See, before you're scared to even open your mouth, let me tell you mine. I think all of you will be able to hear this then and talk and come out, because unless you come out with it, you'll not know. See, I had a best friend of mine. Her father used to work with Kisan, and I'm talking of 1976. 1976, I was in Delhi College. So her father was in Kisan, and he would go abroad always. So he would bring all kinds of goodies, which used to be chocolates. We would all get chocolates to eat once in a while. And one day, Surekha, that's her name, my friend, we are all 64 years of age today. She pushed me into, we had lockers in Government Dental College, we had lockers, which were on the main corridor. So she opened the locker and she said, get inside. So get inside the locker, head only goes in, only this much of the body goes in. And there she's got a lit cigarette, one long brown one. Take it. So I said, no, I don't want it. I see enough cigarettes. No, take it. So take it and see. This is different from what you'd have smelled your dad smoking. So she pushes it in my mouth. She pushes it. So you see, there is somebody forcing me in the corridor, in the college, in the open, in the daytime. And she pushed it in. And I till today remember that menthol smell, and I can understand that why people can't leave that menthol and why we have to get rid of menthol. Because that one time I coughed, it was terrible. I never used it again. But all of us have got some pressure or something because of some friends or birthday party as doctor. Because today your age is different. You all are all much younger, much younger. But if you come up with it, you will be able to understand and talk about your patients. Because that's why it's important to talk, not to say, no, I never did it.
See, the best way of changing your habit is what? If you want to change a habit, then what do you have to do?
Start it now.
So we need to understand why is it bad.
Understand तो ठीक है. Understand तो chocolate भी खाते हैं, वो तो कई लोग बोलते हैं bad habit है ना. Chocolate फिर भी खा लेते हैं. Right? So what do we do if we want to actually change the habit? Number one is, the most important is admit it. Right? Admit that this is a bad habit and I want to change. If you do not admit it, if you resist, or if you do not bring it out, then you cannot change, because you will always try to justify that what you are doing is correct. When I admit that what I am doing is wrong, or what I believe that it is wrong. See, there are a lot of things which someone will believe it is wrong, someone will say that it is right. But what I believe is wrong, and if I admit that, okay, this is wrong and I want to bring a change, I want to change myself, then only that change will take place. Yeah. So by admitting that I have done something wrong, maybe that will help us in becoming more stronger to resist or to at least bring that change in our behavior, right? So, but that was not the question that I was actually putting in. I little diverted myself because of coming up with this topic. So my simple thing is what Dr. Reena has just taught us. उसको बहुत simple way से कैसे समझना है और क्या समझाना है. What do we train and what do we talk to the patients? Simple way. So experimentation. Urvashi, why you did not take it again? And what did you feel when you took it first?
So first time I took it just because, everybody around surrounding was
Okay.
taking it.
I'm not asking that. I'm not asking why you took it. I'm asking
No,
how did you feel?
so it has what I thought is like initially if you don't like one, then they have flavors. Like anyway, they are trying to attract you. So either like something you are going to definitely get addicted to. You'll want to have it again. But because
So
I was knowing I did not.
number one is experimentation, or maybe something like a force. You have been pushed into taking it. And
Yes,
then
sir.
what happens? There'll be two reactions to that. One reaction, what Dr. Reena had, ekdam irritated. It's what is bloody hell out of it? Get out of it.
Yes, sir.
Number one is the pleasure. The second reaction is the pleasure. So there are two groups of people. One who will hate it and hate it forever in their life. And the second group is that who will have pleasure. I will not describe these two groups. Again, we have described these two groups. These two groups are two different types, two different things. The second group is generally the one who has got a loss of communication at home, loss of feeling loved by others. So they are actually a little bit of, have got a little different type of a, bringing up, right? So this second group who has this, who starts liking it, now what happens? Now एक बार तो मजा आया, अगर मेरे को रसगुल्ला खाने में मजा आया तो मैं दूसरी बार तो लूंगा ना.
Yes, sir.
अगर पहली बार अगर करेला खाने में मजा नहीं आया तो मैं नहीं लूंगा सेकंड टाइम. ठीक है ना? So this is our thought process. Now I have taken that. Now मेरे को अब मजा आ रहा है. ठीक है ना? Now I feel wonderful. अब क्या करूंगा? Now I am going to try it again. Now, how does this start? Actually, what Urvashi has said, it starts as a pleasure, right? It starts as a pleasure, and we start taking it whenever we are little low, whenever we find that there is a friend group, when we are getting. So what happens? That person will again take it. Now, what happens to the brain at that point of time? See, I'm just giving the practical thing what Dr. Reena has given. Okay, and then what happens to our brain at that point of time? The brain is activated. It starts, जो हमारे जो receptors हैं, क्या है receptor? What is the name of the receptor?
N-acetyl.
N-acetylcholine.
Nicotinic acetylcholine.
Nicotinic receptors. And there are various types. There are alpha 4, beta 2, N-acetylcholine. So these are the which is in the receptor. So now what happens is the nicotine starts and the pleasure hormone starts coming out from our brain, and it starts activating our frontal lobe. We are feeling pleasure and we get, हम लोग को मजा आ रहा है. ठीक है? हम लोग मजा क्या क्या लेने के लिए, क्या क्या करने के लिए मजा कर सकते हैं? How do we get pleasure? Those who are not taking, all of us, what do we do to get pleasure?
So
हमें भी तो मजा चाहिए यार. हमें वो खाली सिगरेट, तो या तो मैं तो सिगरेट लेना स्टार्ट करने वाला हूँ. मेरे को भी तो प्लेजर चाहिए. I also want pleasure in my life. I want to be happy in my life. So what do? I take cigarettes. है ना?
So do some activities which interest us.
Yes. So Visuja started thinking, yeah, सही बोल रहे हैं Dr. Pawan. I should also start taking cigarette. मेरे को pleasure कैसे मिलेगा?
So we should indulge in different activities which you like. Like if you like dancing,
Your patients, whatever is their hobbies.
dancing.
Yes. So
Whatever. You do different activities.
Yeah. So we also have our pleasure by different activities. We love cooking. We love food. We will play something. We will dance. We will jump. We will play. We will read a book. We will listen to music, and that also secretes dopamine in our brain, and that's normal. That's the normal way of doing things, right? The abnormal way of doing things is getting instant pleasure by taking some medications, right? And there are various groups of medication. The cigarette is one of them, but there are various groups of heroin, ganja, all these things. They also affect in the same area. The alcohol and everything affects in the same area. But now what happens? Now I want pleasure. अगर मेरे को जो बोलते नहीं है, अगर शेर को खून लग जाएगा तो वो क्या करेगा? बार बार खून मांगेगा ना, बोलते हैं ना ऐसा, है ना? हिंदी में कहावत है, शेर को खून लग जाएगा तो बार बार शेर खून मांगेगा. सो सिमिलरली जैसे इसको सिगरेट एक्सपेरिमेंटेशन के साथ होता है, तो अब क्या होता है, उसकी रूटीन बन जाता है. नाउ इट बिकम्स, एंड देन द टॉलरेंस स्टार्ट्स, द ब्रेन स्टार्ट्स गेटिंग टॉलरेटेड. अब उसमें मजा नहीं आ रहा, तो अब क्या होगा, ही विल स्टार्ट टेकिंग मोर एंड मोर एंड मोर. राइट नाउ फ्रॉम प्लेजर, नाउ इट बिकम्स ए नीड. राइट अब उसको नीड पे आ गया कि अब उसको चाहिए ही चाहिए, अब उसको चाहिए. अब नॉर्मल एक्टिविटी, हर मिनट में कुछ भी एक्टिविटी करने उसको चाहिए. अब नेक्स्ट क्या होगा, व्हाट इज द नेक्स्ट स्टेज? नेक्स्ट स्टेज इज दैट फ्रॉम प्लेजर इट हैज कम टू ए नीड. नाउ what the next step comes, it becomes more and more toleration, and the person, when he doesn't have tobacco, it gives a withdrawal symptom. ठीक है. नाउ द बॉडी इज सो मच अडॉप्टेड कि निकोटिन लेवल रहने से ही उतना ब्रेन काम कर रहा है, ब्रेन उसके बियॉन्ड काम ही नहीं कर पा रहा. तो बियॉन्ड जैसे निकोटिन खत्म होगा तो वो बंदा क्या होगा, उसका बॉडी विल start demanding, and body will behave abnormally. Right now this particular brain has become adopted to have so much of nicotine in the brain. If there is a decrease in the brain, nicotine in the brain, this body will respond or react differently, which is what is called withdrawal, and now it has become a disease. ठीक है. So initially the person wants मजे में, ठीक है, उसके बाद अपना काम करने के लिए चाहिए. तीसरा लेवल पे जब आता है, उसको अब अपने बॉडी को मेंटेन करने के लिए चाहिए, उसको विड्रॉल सिम्टम्स को अवॉइड करने के लिए निकोटिन चाहिए.
Yes, sir.
ठीक है. कैन यू अंडरस्टैंड द हाउ दिस जर्नी हैज टेकन प्लेस? राइट नाउ दिस हैज बिकम ए डिजीज. नाउ अब मेरे को जब व्हेन आई हैव कम टू दैट स्टेज व्हेन आई कैनॉट स्टे विदाउट निकोटिन, बिकॉज इफ आई स्टॉप निकोटिन आई एम गोइंग टू हैव withdrawal symptoms.
Withdrawal symptoms.
That is the time. So first stages में जो हमारा जो first stage है, जब हमारा जो young whatever whoever it is, if he started taking tobacco, अगर हमारे खाली pleasure के लिए ले रहा है, अगर हम उसको alternate देंगे, so what happens? What is the alternate that we give him? Yeah, we give him some alternate, like playing, cycling, dancing, sport, some activities, you know, that will also give him pleasure, right? ठीक है. So what happens is he will stop enjoying or he will stop taking the tobacco. So that is the intervention that time. The second stage में क्या हो गया, when there is a need or when there is a right. So here in the need, or what we call it as mild moderate type of addiction. So what happens is now this person will be requiring behavioral therapy as well as pharmacotherapy, right? And when the person has come into that addiction level, when he is not able to quit because he's having withdrawal symptoms, right? That time he definitely needs medications and behavioral therapy. He would have a lot of other diseases, comorbid conditions, like he would have hypertension, he would have cardiac problems, he will have neurological problems, he would be having some oral submucosal fibrosis, he would have pre-malignant lesions, he will have so many other infertility, so many. So that also needs treatment. So that is the comorbidity management, right? But what is the most important? So this is the understanding that how the brain responds and how we need to take care of that patient person. ठीक है, समझ में आ गई?
Yes, sir.